Dental Bytes with Dr. Dunlop is sponsored by Better Life Center Implant and General Dentistry.
All right, this morning we are continuing our monthly chat with our friends over at a Better Life Center Implant and General Dentistry to talk all things dental. And the owner of the practice, Dr. Ryan Dunlop, joins us now to talk specifically about the link between gum disease and heart disease. Good morning, Dr. Dunlop. Thank you for being here.
Thanks for having me. Yeah, it's a well-known, established fact in the dental industry that there is a correlation, a link between the health of your gums and your teeth and the health of your heart. And so it's a good service for people to understand that there's a link between your heart health and your gum health.
Yeah, so talk about the difference there between the diseased gums and healthy gums. Let's start there.
Right, so healthy gums are pink and healthy. They don't hurt. The teeth are not loose. You can see a picture here. Gum disease usually shows as redness around the teeth, pain and swelling. Sometimes there's bleeding. Healthy gums on the other side here are pink and not inflamed. They don't hurt. So that's kind of the difference between someone who has gum disease and someone who has healthy gums.
Okay, so let's talk about the stages of gum disease. I'm sure there's a minor versus a severe.
Right, just like most things, there's the beginning phases, which we call gingivitis. That's very common. Okay. Something like 70 to 80% of Americans have it. It's easy to treat. You go to your dentist, they clean your teeth, they clean your gums, and usually gingivitis goes away. But as it progresses, if you ignore your gums and your teeth, it can certainly get worse. And this is what this picture is supposed to represent, kind of the stages of gum disease. Periodontal disease is the official name. You have gingivitis, you have periodontitis, and then you have moderate to severe periodontal disease. And this is where you're going to start to lose teeth. This is where you're going to start to have infections. And this is where it's going to start to impact your overall health, like your heart health.
It looks like your gums are just kind of like withering away.
Well, yeah, we call it recession or bone loss. Your teeth are anchored by bones and gums, and if your bone and your gums recede away from the teeth, as you can see on the right side, teeth can start to get loose or infected, and that's where you really, really need to see a dentist.
Okay, so let's talk about how this is all linked to heart disease.
Right, so there's a lot of dental literature out there to support this. The bacteria that get into your bloodstream from your gum disease or from your diseased teeth, that can end up in your heart, and it can cause cardiovascular disease. There's a link between our heart and our bloodstream, obviously, and inflammation in the body associated with loose or painful teeth can absolutely translate to a higher risk for heart disease, which we know can lead to heart attacks, and stroke, and high blood pressure. Oh my gosh. So it's quite serious that you manage gum disease, and it'll help keep your heart healthy as well.
All right, so let's take a look at a picture of somebody with gum disease, and we'll pull that up here and see what we're
so this picture is a little graphic, but it just shows the extent that gum disease can really destroy your teeth and gums.
Wow.
And this person, this is the end result of severe gum disease, and this is a opportunity for this patient to remove teeth, replace them with something like dental implants or dentures, and kind of cure that gum disease. It's very, very hard to repair or heal from this. This is kind of the end stage that we're trying to avoid.
Wow, okay, so by contrast, we're going to show a picture of somebody who's been treated for gum disease here.
Right.
Obviously, they've got a mustache.
Yes, grew a mustache, and this gentleman had advanced gum disease, just like the picture you saw before, and we were not able to save the teeth, and the decision was made to use dental implants and dentures to replace his teeth. So now you can see he has beautiful smile, beautiful healthy teeth, and no more gum disease. So dental implants can be one solution that you should talk to your dentist about treating your advanced gum disease.
Okay, and just for clarity, that hair is not growing out of his teeth. Everybody there, just so you know, he's got good-looking teeth there.
He's got great-looking teeth.
Great-looking teeth. Thanks to this guy. Yeah.
So yeah, it's absolutely important for your overall health, for your dental health, to see a dentist regularly to treat gum disease, and there is a clear link